you can't be scared of anything that I haven't been scared of. And I made when I started in 1984, not a lot of people were placing, especially general dentists, were not placing implants. And I made the bright decision to try to, my first implant was going to be number 7.
We want the confidence to know that the verbal skills we're giving our clients that lead to large case acceptance can be delivered confidently by our clinician.
And I got to know what stands in your way of doing what you're telling me you want to do.
This is Dental All Stars, where we bring you the best in dentistry on marketing, management, and training.
Welcome to Dental All Stars. I'm Eric Vickery, president of Coaching All-Star Dental Academy, and I'm very excited to introduce our guest to you today, interview him. It's Dr. James Sanderson, the one, the only. Some background on Dr. Sanderson. He graduated from the University of Alabama School in 1984, where he received the Joseph Lazansky Oral Surgery Award, as well as the Dentsply International Crown and Bridge Award. He practiced dentistry in Birmingham for 32 years, where they practiced laser-assisted microscope-enhanced comprehensive dentistry. That is a mouthful right there. Obviously, implants were a big focus for him, sleep apnea treatment. And then after retiring from practicing dentistry, he joined Steve Bogan, to become a mentor for dentists as the clinical advisor for BioHorizons. He's helped dentists all over the country implement dental implants in their practice successfully. And now he's a coach for All-Star Dental Academy as our implant specialist coach. So today we'll be introducing him. We'll also be talking about how he helps practices implement all phases of dental implants. So please welcome Dr. James Sanderson. Thank you for being here.
Well, thank you. I really do appreciate the opportunity. This has been a lot of fun getting to know you.
Excited to finally have you on the team. So for everyone who knows the coaching tree here, my mentor, one of my mentors, Paula Harris, is dear to both of us because you found Paula Harris. You found her and you helped create her. You have to say that, right? You helped make her who she is.
There's two ways to look at that, but she talked about focusing on not focusing on the fruit necessarily in your practice to start with, to focus on what creates the fruit, and the fruit will come.
Well, in a way, I'm here because of you. So if we think about it that way, it's all part of the coaching tree. And you were part of a coaching tree even in college too, right?
I was, yes, I was. I was very fortunate to have the opportunity. Went to the University of Alabama to become an athletic trainer. Um, I was there from 1974 to 78. We had a great run then. We thought we should have won 2 national championships. We won 1. Uh, and um, and then as time progressed, Dr. Volker, who was the first dean of the dental school when my dad was in the first class, by the time I was at Alabama, he was the chancellor. And through some conversations with him, I was pretty set on I'm going to be an athletic trainer. And he had a couple of conversations with me, and one of the end results of that conversation was that the thing that he missed about wet finger dentistry was that if his mind could see it, his hands could make it. And I was like, Dr. Volker, that's a problem. I know how to do that. I'm not sure exactly how that happens all the time, but I know how to do that. And I said, well, Dr. Volker, here's the problem. If I'm going to go to dental school, I've got a lot of C's that I've made so far. And he said, well, that's the last one of them you're going to make. So, got in dental school, and once I got in the clinic, I was really at home.
Yeah. You found your place. Yeah. Well, I'm so glad you did. We're so glad that has all of those things and more have led you to this place to be with us, and that you're willing to pour into others and mentor and be a part of the All-Star Dental Academy team from a clinical standpoint. We've got a few dentists on our team to coach, and a couple in the clinical world. And one of the areas you coach is in implants, successfully, uh, getting those into your practice in a healthy way and helping dentists not only launch those, but take it to the next level, which really love. So today, I want those listening thinking about, why are we doing the level of implant dentistry that we're doing, whether that's zero, just finishing the crown delivery, or just these surgeries or whatever that might be. And so I know there's a list of questions that you take dentists through, and I want to go through that with you today, have them get a feel for you and who you are and the level of credibility you bring in this world.
Speaking about implants and implementing implants, you can't be scared of anything that I haven't been scared of. And I made when I started in 1984, not a lot of people were placing, especially general dentists, were not placing implants. And I made the bright decision to try to, my first implant was going to be number 7,
Oh, right up there in the front. Okay.
right up there in the front, and no bone. I thought I won this oral surgery award. I got to be
Yeah.
good and all this
Yeah.
kind of stuff. And that was a very humbling start. But we
Yeah.
ended up with a great team and did the first all on 4 in the state, the first teeth and hour in the state. Did some really, had a great team
Hmm.
around me
Yeah.
in every way.
Yeah, wonderful. Well, let's jump into those questions and let's see where it takes us today. And we'll spend less than a half hour because we respect the listener's time. We want you guys to get good value out of this in as short amount of time as possible. So, would you say you're passionate about implants, or why are you passionate about implants?
I'm passionate about implants for a number of reasons. Um, I had an ongoing kind of battle with Carl Misch that we never really spoke about, but his in the beginning he talked about, hey, look, when you lose a tooth, the first thing you should do is place a dental implant. And I'm following my dad's practice of 25, 30 years at the time, and he's got lots of 3-unit bridges out there, all doing well because he had, been trained with Dr. Pankey and knew how to put stuff together. And I'm like, Carl, I can take a tooth out, make a 3-unit bridge, wait 2 weeks, take an impression for the soft tissue, and I'm done. And not until I had a bridge that failed on me, that my dad had done, where I was missing a lower bicuspid, um, and the anterior abutment came loose. And so I called a friend. He reprepped it, took impressions, and next morning I'm in the shower, and I'm like, and Carl Misch is just all over me. You know,
I told you so or something? Is that what he
right?
said?
You think you're this great dentist. Are you providing the best service possible? And what happens to the teeth on either side once you cut them down? What happens to the teeth on either side if you don't cut them down? And I was just like, I called my technician and I said, hey, that impression you got of mine yesterday, throw it away.
Throw it away. It's no good. It's not going to happen, huh? Yeah. 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 So you realized some of that moment when it came to implants. Did you end up, so I'm curious now, did you end up doing like a 3 unit implant supported bridge? What'd you do there?
No, I had teeth on either side, and I
Mhm.
so I just had one single missing tooth in the
Mhm.
lower second bicuspid, and
Yeah. Oh, so you did an implant in that abutment space and you crowned the 2 other teeth then. I gotcha. Okay. And how's that implant doing now?
it's doing fine. The anterior abutment was a 3/4 crown. Is a 3/4 crown again. The back one was a regular crown, and it's a regular crown again, and that should last. I'm 69 years old. That should last my lifetime.
All right. I love it. Well, so that created a realization for you that, hey, implant's the way to go. Then you go down this path of implant studying and everything. So I think there's a correlation here. I love stories. I think people learn from them. I'm sure every dentist out there is like, where do I want to be? I've got clients I talk with, like, I just want to restore the implant part. I just want to do that. I'm doing extractions, but I'm not even placing the bone graft. I've got others that are like, I love doing all on four, all on X, but I hate marketing it and I hate the expectation of it, and everywhere in between. So so the first question I think that we want to have dentists asking is about do or not do when it comes to implants. So what would you say to that, and what do you want them thinking about first?
You know, what are you comfortable with? You know, where are you in your journey? I mean, there's a clinical learning journey, but there's also an implant learning journey. You know, if you, depending on what school you went to, where you were trained, if you're a general dentist, you've had people tell you that you shouldn't be placing dental implants, and that's fine. Uh, Make sure you've got a friend that does it really good. And regardless if you're placing implants or not, you need to have specialist friends for special times because they will come.
Mhm.
Um, but sort of figure out, okay, well, maybe at first I just want to restore implants, you
Mm.
know,
Mhm.
and have somebody do that. And that's sort of how I didn't do that. I kind of tried to jump in there the whole thing. But I also had friends that placed implants for me. And part of the problem was in those early days, some of the oral surgeons, I'd get an implant back in the anterior and it would be sticking out the front. And they were like, well, I put it where the bone is, James. And I'm like, yeah, but I don't, I can't turn this corner to make this thing look like a tooth. And so that was the place where I said, okay, I've got to learn how to graft. And for me, um, I took 2 grafting courses about a year apart. I would come back, and this was just my learning. This is my learning. I would come back from the course, and Miss Jones, I'm so sorry, I can't save your tooth. We've tried, we've done this. We're going to take it out. It's going to be X dollars to take the tooth out, and then you need this bone graft, and it's going to be really great, and it's going to help you, and we'll be able to put an implant in there and all this. Well, I'm not sure I want an implant, Dr. Sanderson. Well, how much does that cost? Well, X plus, and nobody bought my graft. Nobody for 2 years. Taking another course. I mean, I'm slow. And same kind of thing happened though. About 2 years into it, a patient came back and said, "Hey, I want one of those implants that you talked about." I was like, "Great," So I looked in the mouth and I was like, "We have no bone." The bone was very very thin, and at the time I didn't know how to do an online graft. Today I know how to teach you how to do an online graft, but at the time I didn't know how to do that. And so, sort of the same kind of thing the next day, getting ready to go to work. And I'm feeling bad about it. And I'm like, again, you're this, you think you're doing the best you can for your patient, but you're not. You do gold work in Crown and Bridge or whatever the best is, you buy the best products and all that stuff, but you're not. And so, I hit the place and I said, okay, well, I'm never asking somebody if they're going to do a bone graft again. And right. I said, I'm sorry, Miss Jones. We're going to have to take this tooth out. We're going to take the tooth out. We're going to graft it. And that's going to be cost this.
I gotta tell you, I was shocked the other day. I don't know about shocked. I was surprised. I was talking with a client, and this client, I mean, I've worked with them for a long time, 15 plus years. And he told me, yeah, he loves doing surgery, does extractions on and not putting bone grafts in at all. Because I'm not a dentist. I can't speak to that. I'm not like, well, why not? I just was trying to understand his perspective. But absolutely, I'm like, wait a second. I thought all dentists were putting bone grafts in after extractions, and maybe they are. Maybe he's a little old school. I'm not sure. But he was like, you're right. I need to do that. And I think there was a barrier to saying, would you like versus he just wasn't doing on all of them. I'm like, no, it's all of them. I guess then the dentist now listening to this is thinking, well, where am I in my journey? You're talking about your journey of clinical training, and they got to figure out where are they in their journey too as well, and what's the next step? How comfortable are they with what they've done, right?
And what's the end goal? Where, you can't get somewhere if you don't know where you want to go, and it doesn't matter. I'm proof. It doesn't matter how little you know when you start.
Yeah. Yeah, we're all there. So, and maybe I think sometimes too, I hear from clients, I'm going to take this course, I'm going to take this course, and it's just this decision they're making, and maybe there's some pros and cons of different courses they can go in the implant surgical world, I'm assuming.
Oh, there are tremendous numbers, and
Yeah.
there's a wide variation of what you get.
And based on what your vision is, it needs to be in alignment with that, right?
Right. And
Yeah.
in some cases you go and you pay. Before I started working for Steve Bogan and and spending time in Implant Pathway, the courses I took that were involved courses, you January you'd go to lecture, you know, take a tooth out, graft it, wait 3 months, go back to lecture, put the implant in, lecture, wait 3 months, come back, uncover it, another month, come back. Yeah, well, yeah, did it work or not? And then, and at the end of the year, you've placed one implant. Yeah, and so there are better ways to do that. There are better, and for me, I've had the opportunity to sort of get to know most all of them in the business, and so depending on what you're trying to do.
Let's get into that. So my next question is, I'm listening to this as a dentist, or maybe this my treatment coordinator is listening, is going, "Hey, my doctor needs to hear this." How does it work? When uh, an implant clinical coach is working with me, what are you doing for me as the implant clinical coach with my practice?
I got to know what the mission and vision is. I got to know that first, and I got to know where you are currently, and I got to know what stands in your way of doing what you're telling me you want to do. And because and that's sort of the same thing you do with patients that want treatment. It's the same kind of process. And then we got to figure out, okay, what are the things you got standing in your way? Well, I got 3 kids in college, and I can't afford to spend $20,000 on an implant course. Okay, well, then let's do something different. And maybe when you get the kids out of college and then go do that. But if you spend that money on a course, you're going to get that money back. I mean, when you really implement dental implants into the practice, one of the things that happens um, when you really do it is the bottom line goes up really pretty significantly. And like today, you can place a single implant in 10 minutes. And I don't know of anything from a fee perspective that I could do in 10 minutes um, other than place an implant.
I think you need to repeat that. I think that's so powerful. I don't think people understand this. Go say it and I mean, put some numbers to it. Yeah. 10 minutes of a procedure.
Where then you charge whatever $1,500, $2,000, whatever the number is. You can't. There's not another procedure in dentistry start to
Mm.
finish in 10 minutes. You're through and make that amount of money.
And you're providing probably the best care possible for the patient.
Yes, and depending on what you're doing with it, say, and I don't want you to start here, but say you do have an anterior tooth that you're going to have to take out, and you want to place the implant in today. Well, one of the things that you can do, you can have a doctor plan the case for you and do a guided case, place the implant through the guide, and then you have an abutment and a temporary crown to screw into that implant today. And now you're forming the tissue like you need to form the tissue right now. And you're not worrying about cutting on teeth up on either side of it or any of that other stuff. You're making your life easy.
Yeah. Yeah. Love it. Love it. So good. And so look, the reason we're bringing uh, this type of coach on our team is we want the confidence to know that the verbal skills we're giving our clients that lead to large case acceptance can be delivered confidently by our clinician. And we want somebody to run alongside them so that last thing I want to do is teach someone how to sell something, to use that word sell, that they don't know how to deliver. I don't want to put anybody in a bad position. No one on our team does. We want to have integrity with what we're doing. And so we want Dr. James Sanderson here to help you, guide you in your clinical uh, training adventures journey to better implants.
You don't have to make the mistakes. I've told you 2 mistakes I've made already. That were, you don't have to make those same mistakes, and you can learn how to listen to the patient. And when I started, my case acceptance rate was around 25%, maybe, if I was fortunate. And some of the large implant companies working today that do these large cases, their case acceptance rate is around 18 to 25%. If I were still practicing or was able to go back, I'd find one of those and set up next door. But you can have, when we quit practicing, basically I didn't present care until I knew the patient wanted the care. And it wasn't really a question of, am I selling you or trying to manipulate you or trying to whatever. We're both getting to the place that you want to get.
The patient and you. Yep. Yeah, you're the guide. They're the hero, you're the guide. If you've been listening to us over the years, you know that we have a case presentation formula, that Dr. Sanderson comes from the same coaching family tree and understands that lingo that we teach. So if you're wanting to jump in with this and be a part of what he's been doing for a long time now and mentoring and coaching on the clinical side of implants, please reach out to us. In fact, send an email to heather@allstardentalacademy.com. Heather Nottingham, she's amazing. She's our co-founder. She's an incredible trainer herself. You guys know who she is. So just send her an email. Just say, hey, I heard the podcast with Eric and Dr. Sanderson. I want to learn more about clinical coaching when it comes to implants. And I think we're going to do another podcast on sleep apnea dentistry, right?
Yes, that's the plan.
That'll be the plan. So stay tuned for more of that. Thank you, Dr. Sanderson, for joining me today. I really appreciate the time that you set aside for us to do this. Thank you.
And I appreciate the honor very, very much. Thank you.
So much more for us to say about this. We're just literally scratching the surface. Hopefully it gives you some thoughts today. If you've stuck with us this long, please do me a favor. Make sure you're following the show. Make sure you're liking these things. We would love a review on whatever platform you're listening to us. That tells other people they should listen as well. And share this with someone. And thank you so much. Again, send an email to heather@allstardentalacademy.com. She just sits down, talks with you, spends some time with you on what it is you're looking for when it comes to helping support your practice. Thank you all for listening. And until next time, go out there and be an all-star.
We hope you enjoyed this episode of Dental All-Stars. Visit us online at allstardentalacademy.com.